Are you a woman and considering hormone replacement? Perhaps you're in perimenopause or menopause and you're experiencing common symptoms: hot flashes, night sweats, vaginal dryness, cloudy thinking, joint pain, fatigue, insomnia. There's so many symptoms you can have with the menopausal transition. So I want to talk to you about the difference between synthetic and bioidentical hormones. Now, it has been throughout the recent decades where estrogen replacement has went through different phases. Originally in the 1960s, a pharmaceutical company heavily promoted Premarin, which is a synthetic type of estrogen because it's not the same as what the body makes. Actually, it's taken from concentrated pregnant mare's urine. And it was heavily promoted in a book called Feminine Forever. And what we found out later times was that there was a gynecologist who was paid to write this book with an association with a pharmaceutical company promoting this product. And so this was a popular product for many years. And then a study came out called the Women's Health Initiative, and it found increased rates of breast cancer. And so then there was a big scare. And so women were advised to really not use this type of estrogen or use estrogen at all. Then in recent times, they found out when they reanalyzed the data from the Women's Health Initiative that estrogen replacement really wasn't that harmful in terms of increasing cancer risk, especially with short-term use. As a matter of fact, when we looked at the data, it appears that most of the harmful effects of hormone replacement would come through using synthetic progestin, which is not bioidentical progesterone. Well, I hope you're enjoying the video. If you're looking for quality supplements, go to my website, drstengler.com, and there you can see the nutritional supplements I've been using with my patients for many decades. They involve a lot of scientific research. Many of them I've created myself. So again, thank you for watching the video and check out my supplement store at drstengler.com. In any event, hormone replacement can certainly be used with women. It has many benefits. It reduces the symptoms quite dramatically, very quickly. It helps with quality of life. It helps with bone density. It can help to reduce cardiovascular risk factors. So when done properly, bioidentical hormones, which are hormones similar or identical to what the body produces, are very effective. And so I've used them with patients for many decades, and more doctors are using the bioidentical hormones. In terms of hormone replacement, usually during perimenopause and menopause, we'll use estrogen, we'll use progesterone, sometimes bioidentical testosterone, adrenal hormones like DHEA, pregnenolone, and there's some other ones that could be used if a woman is deficient in them. Now, certainly not all women going through perimenopause and menopause need hormone replacement, but if you have more moderate to severe symptoms, then yes, bioidentical hormones are very effective. Also, if you have osteoporosis or you're at high risk for osteoporosis, in the early stages, using hormone replacement can be very effective in helping with bone density. If there's a strong family history of Alzheimer's disease, there are some studies that demonstrate when taking estrogen earlier in the perimenopause and menopausal years could be protective against cognitive problems and reducing your risk of Alzheimer's. So we know that estrogen replacement therapy, progesterone, testosterone, all these bioidentical hormones can have benefits in the body. So what I do with patients is we'll go through the symptoms, we'll go through your history, your family history, and then we'll do testing and see where your hormone levels are at. And then once a woman is on hormone replacement therapy, the bioidentical forms will monitor their symptoms, will monitor their lab values, and then you have proper assessments throughout time. And this can be done very safely and effectively. So the take-home point is do not be scared of hormone replacement. If you're using the bioidentical hormone replacement, it can be done with very good safety, and it's very effective in improving quality of life, getting you through that menopausal transition. And like I said, has many other benefits that range from the hair, the skin, the heart, the bone health, mood, energy levels, joint health, and many other things. So I hope you found this video helpful. I have many other videos on menopause and hormone replacement.